My name is Julie Jacobs. I have been a registered nurse here at Altaview Hospital for about 11 and a half years. I have worked for endoscopy for about 10 and a half years. And the thing that attracted me to this specialty, I actually was working on the med-surg floor here at Altaview. And after 2 years, I wanted to come to short stay. And when I interviewed for short stay, I was told that I would have to learn endoscopy. And I was okay with that because I was so excited to get to a new place. And when I was trained in endoscopy and worked short stay also, and still do today. I only worked 1 day of short stay and 2 days of endoscopy. I really like the people that I work with, and so that has made it very easy to stay. It's not a glamorous part of the hospital, the endoscopy unit, but I like the people that I work with so much, and I really like the patients as well. It's fun to work in a wellness area. I really think, once again, that the people that I work with, we're a good team, and when things go well, we do reward each other and are positive with each other about the things that have gone on. As far as future goals, I would like to stay with Intermountain. My husband eventually will retire in probably 6-7 years, and would like to stay with Intermountain if we move somewhere else. And that has been the place I have always wanted to work since I have become a nurse.
It's Laurel Parkinson, and I'm a registered nurse at the endoscopy department. What I like about working in the endoscopy department is we have 3 areas that we work in. We have what we call the pre area, and with that I enjoy it because I like to keep my IV skills up. Then we come into the procedure room itself, and in there we work with the doctors, we work with the patients in sedation, and so it's kind of a more one-to-one type of a situation. And then when I'm working recovery, it's nice to work and teach discharge instructions with the patient and the family, and then you get to take them out to their vehicle to send them home, so you get a little bit of the outside world. So it's kind of nice that you get to have all those areas. It's a Monday through Friday, holidays and weekends off. You do have on-call, but between the other nurses, we're only on call about 7 days in a 2.5-month time frame. So it's really not that bad. But I've done the floor nursing, I've done the holiday call and things like that, and I just wanted to spend some time with my family and husband and not be working till all hours of the night. I love the people I work with. Our supervisor is just fabulous, and I think that's what has really kept me here, is the way that we are treated and the fun that we have with each other.
We would go out to the waiting room and get the patient. Then we would take them and weigh them where the short stay area is, and then we would bring them back here to the pre-op area. This is where we would give them, get their blood pressure and their vital signs. They would sit in a chair, their family member would sit here, and we would explain the procedure to them, especially if they have never had the procedure before. We also go through the discharge instructions with them ahead of time, so they're aware of that when they leave. Sometimes they're a little more sleepy, and we start their IV and of course let them get changed. Then when they're all ready to go, we usually take them over to this area right here. There's usually a stretcher here, and we'll get them all ready on the bed. We do monitor 3 lead, and we'll get a blood pressure cuff on them, and then when the room is clear, we'll walk them back into the procedure room. We bring them back here. They lay on their back, and the doctor will talk to them and explain the consent a little more to them. We'll get them all hooked up with their vital signs, put them on oxygen, and then the scope hangs here, and there is a tech also with the doctor. The local monitor nurse is here, and she administers the medication. We use propofol for most cases, and so after they've talked to the doctor, they roll onto their left side, and the local monitor nurse starts the medication in their IV, and that works after about 20 seconds. They drift off into a nice deep sleep. The doctor does the procedure while they're sleeping, and then when we're done, we take them to a recovery room, which is located right out here. Bring them in here, and of course we keep track of them again for another 20 minutes. They're usually pretty awake at that point. We make sure their family member is with them, and the doctor will come and talk to them and let them know how things went. They'll get pretty pictures, and we'll get them something good to drink, give them the discharge instructions once again, and they're on their way.